Chapter 12. Soul Medicine as Conventional Medicine. We have to recognize that we are spiritual beings, with souls, existing in a spiritual world, as well as material beings, with bodies and brains, existing in a material world. Nobel Laureate Sir John Eccles. Tim Garten, a world champion swimmer, was diagnosed in 1989 with stage 2 non-Hodgkin's lymphoma. He was 49 years old and had a tumor the size of a football in his abdomen. It was treated with surgery followed by 4 chemotherapy treatments over 12 weeks, with subsequent abdominal radiation for 8 weeks. Despite initial concern that the cancer appeared to be terminal, the treatment was successful. And by 1990, Tim was told that he was in remission. He was also told that he would never again compete at a national or an international level. However, in 1992, Tim Garten returned to competitive swimming and won the 100-meter freestyle world championship. In early July of 1999, he was diagnosed with prostate cancer. A prostatectomy in late July revealed that the cancer had expanded beyond the borders of his prostate and could not all be surgically removed. Once again, he received weekly radiation treatment in the area of his abdomen. After 8 weeks of treatment, the cancer had cleared. In 2001, the lymphoma returned, and this time in his neck. It was removed surgically. Tim again received radiation, though this time it left severe burns on his neck. The following year, a growth on the other side of his neck, moving over his trachea, was diagnosed as a fast-growing lymphoma that required emergency surgery. He was told that the lymphoma was widespread. A bone marrow and stem cell transplant was done at this time, but it was not successful. There was also concern that the tumors would metastasize to his stomach. The doctors determined at this point that they could do nothing more for him. He was told that highly experimental medical treatments, for which there was little optimism, were the only alternative. He was given an injection of monoclonal antibodies, Rituxan, which had been minimally approved for recurrent low-grade lymphoma. Rituxan is designed to flag the cancer sites and potentially help stimulate the immune system to know where to focus. At this point, Tim enlisted the services of Kim Wedman, an energy medicine practitioner trained by Donna Eden. Tim and his wife went to the Bahamas for 3 weeks, and they brought Kim with them for the first week. Kim provided daily sessions lasting an hour and a half. Now, these sessions included a basic energy balancing routine, meridian tracing, a chakra clearing work with the electrical, neurolymphatic, and neurovascular points, a correction for energies that are designed to cross over from one side of the body to the other, but are not, and a daily assessment of his other basic energy systems, followed by corrections for any that were out of balance. While Tim was not willing to follow Kim's advice to curb his substantial alcohol consumption or modify his meat and potatoes diet, he did introduce fresh vegetable juices into his regimen, plus an herbal tea, fluorescence, and that is believed to have medicinal properties. Kim also taught Tim and his wife a 20-minute, twice-daily energy medicine protocol, which they followed diligently both during the week she was there and for the subsequent 2 weeks. The protocol included a basic energy balancing routine and specific interventions for the energy pathways that govern the immune system, and that feed energy into the stomach, kidneys, and bladder. Upon returning to his home in Denver, in order to determine how quickly the cancers might be spreading, Tim scheduled a follow-up assessment with the oncologist who had told him there is nothing more they can do for you. To everyone's thrill and surprise, Tim was cancer-free. He had remained so during the 4 years between that assessment and the time of this writing. He has been checked with a PET scan each year, with no cancer detected. Was it the energy treatments or the single Rituxan shot that caused the cancer to go into remission? Over those 3 weeks, no one knows. Tim still receives the Rituxan injections every 2 months, but he also continues to work with Kim Wedman on occasion for tune-ups. Now, while the names and other identifying characteristics of patients whose cases are described in this book have been concealed, in this case they have not. Tim Garten gave his permission for this story to be published. Kim Wedman, the energy practitioner who worked with Tim Garten, trained with Donna Eden, author of Energy Medicine, and her husband, clinical psychologist David Feinstein, Ph.D. Energy medicine in hospitals. The demand for patients for CAM, or complementary and alternative medicine, of which energy medicine is a subset, is enormous. A World Health Organization survey finds the use of CAM to be up to 80% of the population in Asia, Latin America, and Africa. In a 2004 survey by the U.S. Centers for Disease Control, some 62% of adults used CAM in the previous year. The number in a 2008 study was 66%. That study also showed that the majority of patients would like to receive CAM treatments in a primary care facility, such as a clinic, doctor's office, or hospital. This wish is taking shape, in fact, as hospitals and clinics increasingly offer CAM services. Although far from widespread, energy medicine and energy psychology techniques are working their way into mainstream medicine. With increased understanding that unresolved emotional and spiritual maladies underlie many physical diseases, Kaiser Permanente, a giant hospital organization with 9 million members, offers healthy living classes, including such methods as Qigong, yoga, and meditation, at many of its campuses. Kaiser's newest building in Santa Rosa, California, where I live, uses natural light wherever possible, rather than artificial illumination. To inspire patients to reflect and meditate, it has a labyrinth that patients and their families can walk. The Portland, Oregon Kaiser Hospital performed a formal trial of weight loss therapies, pitting an energy psychology method called TAT, Tapas Acupressure Technique, against the best of their current therapies. The result was predictably successful, with the TAT group maintaining their weight loss after 6 months, while the group using Kaiser's usual protocol gained back much of the weight that they had lost. Scenting a breakthrough, Kaiser has now proceeded onto a large-scale Phase 2 clinical trial. Kaiser uses EFT in some of its classes, and some of its physicians use energy psychology as they look for emotional factors that might underlie the physical symptoms with which patients are presenting. A study of EFT for weight loss has yielded excellent results, and follow-up studies are planned. All of these things are good for patients, but they're not purely altruistic on Kaiser's part. A patient at an ideal weight with a strong meditation practice and an arsenal of energy psychology techniques for releasing their daily stress is not just a healthier and happier patient. Such a person is also a lot less likely to need expensive medical interventions, with the result that Kaiser is the lowest cost healthcare provider in the San Francisco Bay Area. The University of Texas has a cancer research and treatment facility in Houston called the MD Anderson Cancer Center, in collaboration with a 7-hospital chain called Orlando Regional Healthcare. It has set up the MD Anderson Cancer Center Orlando, MDACCO, in Florida. Besides offering a wide range of cancer therapies and excellent conventional care, MD Anderson has a pioneering mind-body-spirit department that includes an energy medicine program. It was set up and is managed by Patricia Butler, M.A., and uses the techniques taught by Donna Eden's Eden Energy Medicine certification. Butler provides counseling and energy psychology services to the staff, also provides energy medicine services to patients on request to reduce the side effects of chemotherapy and radiation. Information on the energy medicine program is found in the patient information guide given to every new cancer patient. During chemotherapy treatments, Butler may sit with patients and do the work while they are hooked up to the chemotherapy drip. She has observed many beneficial effects in patients who combine energy medicine with their conventional treatments. Patients often report feeling much better during and after chemotherapy sessions, in which they simultaneously receive energy medicine treatments, than chemotherapy sessions where they don't. Energy medicine seems to calm the body's energy systems, enabling them to tolerate the presence of chemotherapy drugs. Butler observes, and that they often don't require further medications for insomnia or listlessness. She wrote the following account of a typical case. Sylvia was 45 years old when doctors discovered a malignant gastric tumor growing right at the joint between her esophagus and her stomach. With the shock of the news resonating wildly throughout her system, she listened as they recommended chemotherapy and radiation to shrink the tumor, followed by surgery to remove what was left behind. Feeling nervous about the outcome, but not knowing what else to do, she followed all of their protocols and underwent the surgery as soon as it was indicated. The good news she learned afterward was that the operation had been a success, and she was now cancer-free. The bad news was that they'd had to remove her entire stomach to get all the cancer. Now they placed a feeding tube in her side to ensure that she would get nutrition, and told her they hoped she could eat normal food one day, albeit with careful new strategies. Although she did her best to recover from both her treatments and the rearrangement of her digestive tract, her quality of life took a real nosedive. The next 6 months were simply miserable. Sylvia's follow-up care was transferred to MD Anderson Cancer Center in Orlando, not her original treatment center, and she learned about the hospital's energy medicine program. She came to see me wondering if energy medicine could help her begin to feel better and get her life back again. As she began to tell me about her very uncomfortable state, I learned that the worst part for her was the nausea that she'd felt every day since her surgery 6 months before. Not only was it debilitating, it kept her from being able to eat, and she couldn't have her feeding tube removed until she could eat again. Along with the nausea, Sylvia still felt quite a bit of pain along the incision, at the tube site, and in her lower back. It took 20 milligrams of methadone 3 times a day to hold the pain at bay, and she didn't like the way that made her feel. This pile-up of daily pain, nausea, and inability to eat left her feeling morbidly depressed. She told me a term rarely used by non-psychotherapists, but one which captured the destitute emotional state in which she found herself. Using the energy medicine techniques that I'd learned from Donna Eden, I began to rebalance some basic energy patterns in her body, and went after the nausea by holding key acupressure points with my fingertips. To her astonishment, the nausea began to ease within minutes. When I told her that she could hold these points on herself and get results, she was both delighted and highly motivated to try it. I encouraged her to do this every day, with the idea that she could retrain her energy system to flow in more functional ways, thereby changing her body's nausea response. Then I cleared and balanced her energy vortices, paying special attention to those that were situated near areas of pain. She could feel the pain beginning to soften as I gently spun these energy centers above her body. By the third session, her nausea surfaced only occasionally, and her pain was described as mild. At this point, I began using principles from energy psychology to identify and clear thought patterns that might be impeding a more complete level of healing. She tapped on acupuncture points while simultaneously thinking about her pain and nausea, and found that it deactivated the negative emotions associated with her thoughts. "I feel good," she said, with a look of surprise on her face. She could tell that the pattern of her symptoms was becoming more intermittent, and she knew that she was moving in the right direction. I explained that while most patients feel relief in the first session, there is a cumulative benefit derived from multiple treatments, as the energy patterns are repeatedly rebalanced, and the body's healing systems are coaxed back into action. By the following week, her nausea was completely gone. Her apprehension about eating greatly diminished, and she began to eat small amounts of normal food. The week after that, to her great relief, her feeding tube was removed. When we are in a great deal of pain and discomfort, it's hard to attend to other matters in our lives, and that was true for Sylvia. Her illness and suffering had derailed her from moving through a healthy grieving process over the recent deaths of her parents. But as the layers of her physical symptoms peeled away, she was able to talk about the sadness that she still felt at losing them. To support her energetically through the process, I worked with her lung meridian, which carries the resonance of grief. She found herself feeling lighter in spirit, still missing them, but now with a lighter spirit. Before we ended her energy medicine sessions, she asked me for help with one more thing. "I'm feeling really scared about my next PET scan and about finding out whether or not the cancer has returned." To soothe her intense anxiety, I had her create a mental videotape of images, thoughts, and feelings regarding the upcoming scan, and I asked her to run it while I held places on her head called neurovascular points that are known to send a calming, soothing energy throughout the body. In less than 10 minutes, her worry had melted away. She felt ready to get the scan and decided she'd just hope for the best. Like other patients with a serious illness, Sylvia brought a myriad of physical, emotional, and spiritual concerns to our energy medicine sessions. She began to understand that each stress that we cleared from her body, mind, would move her to a deeper level of peace, helping to create a more optimal climate for the functioning of her immune system. I was elated when I received a phone message that her scans were clear. At her 10th and last session, Sylvia summed up her appraisal of energy medicine by saying, "My nausea is gone. My pain medication went from 60 milligrams to 5 milligrams a day. I'm eating normal food, and I feel joy in my life again." She was amazed that it had all been accomplished without the use of further medication. 2 years later, Sylvia called to tell me that she was still feeling great. Pat Butler has seen a marked shift in public attitudes toward energy medicine in the past decade. Patients used to make comments like, "I don't know if this fits into my religious beliefs," she observes, "but not anymore. There's a growing awareness that there is a wide set of possibilities for optimal treatment." This awareness is penetrating the research community as well. A group of University of Illinois Chicago researchers recently wrote that instead of trying to fit cancer into a theory employing genetic determinism, we have accepted that dependence upon genetic determinism to explain cancer has become obsolete, and researchers as well as hospitals are more open to exploring how energy medicine and conventional medicine can both benefit patients with cancer and other serious diseases. Discerning an appropriate treatment path. Andrew Weil, MD, has developed a simple formulation to allow a patient to determine whether conventional or alternative medicine is right for their particular condition. In his book, Spontaneous Healing, he lays out a set of criteria that allows both patients and medical professionals to stream patients into either alternative or conventional therapies. It's important for each of us to have at least a rough idea of whether our condition can be effectively treated by allopathic medicine, whether the best leverage points come from an alternative therapy, or whether to combine both. In Soul Medicine, Norman Shealy, MD, and I describe in detail how to work with your conventional physician and your alternative healthcare provider simultaneously. A course we believe often provides the best of both worlds. One of the most intriguing experiments in setting up the clinic of the future, one that encompasses both conventional and alternative approaches, is an establishment called the Integrative Medical Clinic of Santa Rosa, California, or IMCSR. Robert Dozer, MD, and his wife Ellen Barnett, MD, PhD, established their treatment center in 2001. Upon walking into the clinic, the first thing the visitor sees is a wide hall with a fountain and beautiful artwork, which then opens up into a large room with comfortable couches, an altar, another fountain, and a holistic health library. On the way, there is a glass-fronted herbal dispensary and a receptionist desk. Among the practitioners at ICMSR are a chiropractor, a somatic therapist, an acupuncturist, a marriage and family therapist, a naturopathic doctor, and a psychologist. In addition, Doctors Dozer and Barnett have a compendious knowledge of Ayurveda, Chinese medicine, herbalism, and other alternative medical specialties. The treatment protocol is coordinated by a computer system that tracks patient files and updates them in real time. During a consultation with a naturopath, for instance, he enters his notes on a screen that is immediately available to all the other practitioners. He might also walk 10 steps down the hall to consult with the psychologist or with the family physician. If a patient goes from him to the physician has an immediate record of exactly what the naturopath's findings and prescriptions were. This system is essential to the coordination of treatment by so many different modalities. Navigating the options. Barbara Marx Hubbard, one of the world's preeminent futurists, points out that the many of today's occupations did not exist 50 years ago, just as many of the new functions that people do today. Biotechnician, telecommunication specialist, nanotechnologist, environmentalist, futurist, medical ethicist, desktop publisher didn't exist in the 1950s. The job descriptions that reflect our emerging evolutionary vocations or callings are yet to be defined. The World Future Society, in a report on high-paying jobs of tomorrow, lists careers of the future. They include bioinformationalists who study the results of genetic discoveries and package this knowledge for the developers of practical therapies. Telemedicine technicians connect medical teams with patients or clinicians in remote areas. Cyberarians organize online information, and so on. One of the most interesting ways in which IMCSR points to the future is that it has been required the intervention of a new job, an intake specialist or navigator in the IMCSR parlance. This highly skilled person meets with patients and assesses which treatment or combination of treatments might work best for them. The mix might change as they visit different practitioners in the building, but the navigator has responsibility for making the initial determination. Early planning for the IMCSR assumed that a physician would have this responsibility, but the insurance compensation system of the current American medical system means that the physicians are the financial drivers of the clinic. It is their time that generates the most revenue and supports the rest. The structure of the clinic was adjusted accordingly, and the job of navigator created in the last decade. Many other complex medical systems have invented similar jobs. They may go by the name of nurse navigator or integrative health care coordinator, but their function remains to match patients with appropriate treatments. Intention as quantum conversation. It is possible to imagine a time in the near future when paying attention will be the first thing we do when we get sick. Spiritual and emotional remedies will be the first line of defense, not the last. Sufferers will seek metaphysical solutions, not when they've exhausted all conventional means, but instead before they submit to the drugs and surgery of allopathic medicine. Allopathic medicine might become a medicine of last resort rather than of first. It will be used to treat certain conditions for which it is admirably suited, but other, especially some of the recent recognized and still mysterious conditions like autoimmune disorders, will first be treated with non-invasive methods that shift the patient's energy field. Dr. Sheely estimates that surgery or drugs are required by no more than 15% of patients. Many, perhaps most of the times drugs or surgery are used today are inappropriate. Alan Roses, MD, Vice President of Genetics for Glaxo, one of the world's largest drug companies, startled the medical world in 2003 when he frankly admitted that most of the industry's drugs are ineffective. Britain's Independent, the newspaper, reported that Roses said fewer than half of the patients prescribed some of the most expensive drugs actually derived any benefit from them. It is an open secret within the drugs industry that most of its products are ineffective in most patients, but this is the first time that such a senior drug boss has gone public. His comments came days after it emerged that the NHS, Britain's Universal Health Service, drugs bill has soared by nearly 50% in 3 years. A contemporaneous article by respected medical reporter Susan Kelleher reported how some of America's most prestigious medical societies take money from the drug companies and then promote the industry's agenda. The result is that many patients take drugs that are worse than the disease for which they are being treated, or even kill them. Money infects medicine to the detriment of patients. A comparison of studies of drugs used to treat schizophrenia found that the pharmaceutical company whose drug came out on top in the study was almost always the company that had paid for the study. And even when they're prescribed, doctors are not always doing patients a favor. Pharmaceuticals temporarily diminish anxiety, panic, and depression, decrease our emotional and physical pain, or kill hostile germs in the body. Yet they leave the root causes of our ailments untouched and diminish our capacity to feel. And our feelings contain vital information that is essential for our health, well-being, and peak functioning. The closer you scrutinize the alternatives, the more attractive energy medicine becomes. A TAT or EFT session, safe, non-invasive, and usually effective, is a much more compelling first line of treatment than conventional medical therapies for most conditions. It shifts our maladaptive beliefs and irrational fears rather than suppressing them with prescription drugs. Precise energy leverage points. The energy diagnosis of the future might be focused on discovering the precise leverage point required to produce healing. Imagine a log jam on a river, hundreds of logs piled up, producing a blockage through which nothing can pass. Removing the logs one by one is a tedious process, requiring the expenditure of great stores of energy. But if you find the right log or logs that are the linchpins around which the pressure pattern of the whole jam takes form, and remove it, suddenly all the other logs are released too, without the massive application of work required to remove them all one by one. In the same way, each patient responds differently, and it's worth finding their maximum leverage point. One might benefit most from aromatherapy, another from acupressure, another from somatic therapy. One person's log jam is another person's forest. Then, within each discipline, good therapists notice the particular logs that are holding up the flow. A good acupuncturist may stimulate only the 3 or 4 points required to restore balance to the body's energies. A skilled somatic massage therapist will go straight to the zone that releases the most tension the fastest. "How did you know where to touch me?" amazed patients often ask. Good professionals can quickly spot where the maximum point of pressure is in the mass of logs, and pull out just the one log that releases the rest. When the precise leverage point is discovered, you can focus on healing only those items that are holding you back, the single logs in the log jam that are inhibiting vitality throughout your system. The skilled diagnostician and prescriber of the future will be trained to spot the possible constellations of jammed logs, and by going straight to the point of maximum leverage, offer the patient effective relief. Patients who present with various conditions might be trained to discover which thought, linked to which belief, linked to which strong emotion, will release their particular logjam. When precise energy leverage techniques become the front line of medicine, many conditions from which people today suffer will become a thing of the past. Medicine, wellness, and healing look very different in a quantum world than they did in the mechanistic and reductionist world that preceded it. Each new discovery is another indication of how important consciousness is for healing. We are learning to see ourselves and our bodies as malleable, influenced by every thought and feeling that flows through us. Knowing this, we can choose to take responsibility for the quality of thought and feeling we host, and choose those that radiate benevolence, goodwill, vibrance, and wellness. Doing this, we positively affect not just our own well-being, but that of the entire world of which we are a part, and the great ocean of consciousness in which our individual minds swim.